Okay, so here we are. Um, Very exciting. We have our newborn here. Looks just like its parents. Um, so before we get started with our assessment, we're going to begin by making sure, obviously, that we've conducted hand hygiene before we started. We may even be wearing gloves, especially in these troubled times. We're going to make sure that we've got good ambient temperature in here, that we're maintaining thermoregulation whilst we do the assessment. We're also going to make sure that we've identified properly the baby. We've looked at the ID tag, we've checked mum's ID tag, we've gone through all of the normal checks we would do to identify name, date of birth, etc. We're also going to make sure that we've got the security sensor working, everything like that. We're going to talk to mum, we're going to talk about the baby's feeding patterns, we're going to talk about the diapers. Obviously, baby might only be a few hours old, so some of that might not yet be quite relevant. But talking of the baby's age, we're going to have looked at the history prior to doing the assessment. Make sure that we've looked at mum's medical history too, looked at the detailed notes regarding the birth and labour as well. Were there any complications? Did we need forceps, suction, anything like that? What's the baby's blood type? What was the APGAR score when he was born? Was mum tested thoroughly as well? I want to talk to mum about again, diaper, feeding already, whether she's latching on, all that stuff. So we've done all of our hygiene, we've done all of our security safety checks, and we are good and ready to begin our inspection. There's little restless crying a little bit here, so hopefully this won't take too long and we can get him wrapped up, won't get too cold. Okay, so we're going to start by looking at the head first of all. We want to go ahead and check the anterior fontanelle. We should find that this is smooth and flat, maybe bulging a tiny bit if the baby's crying a lot, but it should be smooth and flat. We're going to feel the suture line, maybe slightly open or overlapping, but in general it should have good alignment. We're going to feel back to the posterior fontanelle, which should be smaller than the anterior as it closes first. So we're going to look at the head overall. We're going to make sure that the overall shape is good. If there's any molding, if the baby was, if there was need for suctioning or anything like that, make sure there's no cephalohematoma, caput, or anything like that. So we're going to check the head overall. We're going to look at baby's ears. We're going to check the placement of the ears. We're going to make sure that they're intact. There's no abnormalities or anything like that. We're going to look at the placement of the ears, and also we're also going to check the results of the hearing screen as well. We're going to look at the baby's eyes. We're going to check first of all again the placement of the eyes. Make sure they're aligned, they're symmetrical. We're going to check the conjunctiva. Should be nice and pink. We're going to check the sclera. It's injected, it's white. There's no discharge. We're going to check the placement of the nose, see if there's any nostril flaring. We're going to go ahead and, sorry little guy, we're going to check the patency of the airway, well not the airway, the nostrils. Make sure baby's good breathing out of both sides. We're going to check the mouth. We're going to check the lips, maybe signs of cyanosis, anything like that. We're going to check the rooting reflex with our finger. We're also going to check the baby's sucking reflex, which is also an opportunity to check the palate, make sure it's intact, it's not high, cleft, anything like that. So next we're going to go down, we're going to check the neck, we're going to check the range of motion, we're going to check for webbing, we're going to go down to the shoulders. We are going to palpate the shoulders here. We're going to see if there's any signs of fracture, any crepitus, which would feel like bubbles under the skin. We are going to move down to baby's arms. We'll check the brachial pulse. We are going to go down, check all the fingers are intact. We have 5 on each hand. We're going to check the reflexes of the palm, the palmar reflexes. Let go. Okay. All right. Settle down. Okay. We are then going to check. There's a good guy. Okay. We're going to check the baby's chest. We're going to look at the nipples. We're going to look at symmetry. Make sure there's 2 of them. They're in the right place, the right size. At this point, it's a good time to check baby's respirations and also to auscultate the lungs, the breath sounds. We don't have a lot of space here, but we will go ahead and we will do that. We're going to do the anterior. We're going to do lateral, and then we're going to turn the little guy over, and we're also going to listen at the back as well, posteriorly. We're also going to listen to the heart. We don't have a lot of space, so I'm not really sure where we're going here, but we're going ape to man. So we're going to listen to the heart. We're going to check the apical rate of the heart. We're going to listen, most importantly, to each station to see if there's any sign of any murmur or anything like that. We're going to move down to the abdomen area. Before we palpate, we want to auscultate first. We can see from an inspection standpoint, umbilical cord. We want to make sure that it's it's dry. There's no signs of redness, infection. There's no discharge, anything like that. Then we would remove the diaper. We're going to listen to the bowel sounds. So we hear some gurgling in there. Once we've listened to the bowel, at that point we would go ahead and palpate. See if it's distended, see if there's any masses, anything like that. Once we've done with that, we're going to move down to the genitalia. If it's a girl, we're going to check the clitoris, the labia, make sure the vagina is open. Maybe signs of vernix discharge. A lot of that will be normal. There may be some edema of the labia, in which case we'll document it, but again, it should be normal. We're going to check the placement of the anus, make sure it's in the right place. There aren't any tags growing out of it or anything. If it's a boy, we'll want to palpate, make sure that there's 2 testicles, there's no abnormalities of the penis, that everything's in the right place. Then, once we've done that, we are going to move down the legs, femoral pulses. We'll see the muscle tone of the legs, range of motion of the legs. We can see that they are symmetrical. We will move down to the feet. We're going to make sure that there are creases on the feet as well as on the palms of the hands. We're going to check the toes as well. We're going to check the Babinski. reflex. The toe should spread out upwards. Once we've done that, we are going to turn the little guy over. We're going to check the spine, make sure it's straight. We're going to look for any birthmarks, Mongolian spot, maybe there's stalk marks. We're going to see if there's any sinus, tuft of hair, dimple, and things of that nature. And then after that, really just checking the skin all over, see if there's any other, rashes, markings, abrasions, mottling, and anything like that. And I think we're pretty good for now until his tests come back. Thanks so much. He's been a good guy. He really has been good.